We're going to be talking some mental health, and May is Mental Health Awareness Month, but I reached out to Akron Children's Hospital because they announced last week an expansion into the world of their services in regards to mental health. And kind enough to join us this morning is the Director of Behavioral Health Service Line at Akron Children's Hospital. Dr. Eva Sigathy is on board with us. And Eva, thank you for joining us this morning and talk a little bit more about this story with Akron Children's Hospital.
Good morning. I'm happy to be here this morning. So as we know, kids are in crisis. We continue to see behavioral health visits in all of our settings, emergency rooms and primary care doctors, and even in schools go up. And so we're always thinking as a field of solutions to meet that need. What we're particularly excited about is later this summer, we'll be opening a new expanded inpatient unit at Akron Children's Hospital. We're increasing our beds from 24 to 40 beds, and not only just having more beds, but diversifying our programming. So those 40 beds will have a acute stabilization unit where kids in crisis can come and actually room in even with a caregiver or one parent so they can benefit from more intensive family work, a regular inpatient unit with more beds, and then a high acuity unit where our most severe aggressive or psychotic kids can get the special help that they need.
With us is Dr. Eva Sigathy with Akron Children's Hospital. And Dr. Sigathy, obviously the need is there, and you kind of touched on that at the beginning. It's a crucial, certainly, point when we're talking about children with mental health. And, boy, you turn back the clock, 30, 40 years ago, we would just brush it off sometimes as a society, but not so. And I love the attention that this is gathering. So, talk about the variables, Dr. Sigathy, that go into the need here and how Akron Children's Hospital is addressing them.
I think there is not a one-size-fits-all driver. I think there's many things that work synergistically together to drive this need. I think that we're still dealing with sort of post-COVID adjustment in terms of the way that many children's lives were derailed from their normal developmental routines. Then I think we have the stress on kids in terms of their academic demands, social demands. Then we can't leave out social media and the effect of unmonitored use of, the access to the information that kids have. And we know that some of the material out there isn't helpful. And then I think, we have sort of the kids reacting to things in their environment. So housing instability or even eco-grief in terms of, the teens that are very stressed about global warming. So I think, we could go on with factors, but I think what's important is that there are many things that are causing this emotional distress, and parents, caregivers, teachers, coaches, so anybody who's in a position to have a trusting relationship with any child of any age is really well positioned to have your kids, whether they're younger children or adolescents, talk to you, know where they're going online, and keep them as active in sort of non-tech activities as possible.
Dr. Sigathy, with this expansion by Akron Children's Hospital, certainly into the area of mental health, maybe talk about some of the things that will be more available to them or what will be included in the expansion in this area of health from you folks.
Absolutely. So what will be included in the expansion is that the unit itself will have modalities that we currently don't have. So we're going to have a gym. We're going to have outdoor space. We have novel streams of innovative programming where we're rewarding good behavior with token economy on the unit, getting kids to model the behavior that we'd like to be seeing when they're discharged. We'll continue the intensive family work. We'll continue the intensive therapy. The kids will have medications evaluated, though we always want to use medication only as a last resort. And then, very importantly, we have designated care navigators who help the child step down to the right level of support after their hospitalization. And we have 4 regional centers where kids can get intensive programming, day hospitalization if needed as part of the step down, and then eventually getting them back into the community where their pediatrician offices have embedded therapists.
With us is Dr. Eva Sigathy, again, the Director of Behavioral Health Service Line at Akron Children's Hospital. Dr. Sigathy, let me ask you this. With families being able to take advantage of now the mental health and that road through Akron Children's Hospital, how can they do that? I don't want to use the word necessarily of eligible, but how would these kids be able to take advantage of these services?
Well, any family is potentially eligible. I think that emotional stress knows no sort of limits in terms of age or socioeconomic class or, even in terms of past history. So many families, when they're in crisis, go to our emergency room where we have crisis social workers available to do assessments, to give families recommendations, even if they don't qualify for an inpatient hospitalization. Then, we partner with many community partners. So Coleman is the community partner in this area, in the Akron area, that we partner with for mobile crisis services. So that there are agencies like that can send a worker to the family's home if they're not able to come to the emergency room or if a need is better met there.
With us is Dr. Eva Sigathy, again, Director, Behavioral Health Service Line, Akron Children's Hospital. And Eva, before we end the conversation, and I love the job, by the way, Akron Children's Hospital is doing in this expansion of taking care of mental health, and I think you touched on it, so many different variables. Talk to the parents, the guardians, the grandparents this morning, where we are with mental health, with our teens, and even younger than that.
Where we are is that we're able to recognize stress at a much earlier stage. And one of the ways at Akron Children's that we've been able to obtain that is that we have now 47 pediatric practices that are affiliated with Akron Children's. Each one of those practices has an embedded therapist, so a specialist to help kids, parents, grandparents deal with stress. So really the best starting point is with your pediatrician, and using the services that we have there allow the kids to have faster access to other additional services if they need more intensive care, and then allows for a really special partnership between behavioral health and the physical needs of that child, so that we really, at the end of the day, I think we all have the same goal, whether we're parent or providers, is to get the kids back into their lives. You might have seen the mantra of Children's Hospital, more childhood, please. I really think that's the goal of all of us, is to get kids back to happy, fulfilling lives.
Love that. Eva, thank you so much for the time and the visit, and congratulations on this expansion. Certainly well needed. Love what you folks are doing there at Akron Children's Hospital. Thank you for waking up and sharing the information with us this morning here on WAKR. Much appreciated.
My pleasure. Thank you.